LVAD, left ventricular assist mechanical device, surgically implanted that help the heart to pump blood. Toledo has been selected for this procedure, and you will learn how it's saving lives. We will talk with the expert next on Time Waits for No One.
From the University of Toledo Medical Center with Dr. Ameer Kabour, President and CEO of Toledo Cardiology Consultants. Today, the ventricular assist device with the University of Toledo Medical Center's Dr. Mark Bonnell. And Dr. Thomas Schwann explains how the Toledo medical community is at the forefront of this life-saving procedure. Plus, hear from a patient who's back on the golf course because a pump is helping his heart. Today on Time Waits for No One. Sponsored in part by The Blade.
In this first part, we are going to talk about congestive heart failure as a disease, the etiology, the mechanism, the treatment. And we're going to show you some animation to make that simple to understand, because the picture is worth a lot. And that will explain it in detail so you will have a full comprehension for the congestive heart failure as a disease. Let's go. In heart failure, the heart is extremely weaker than normal. And that means the heart cannot circulate enough blood to the critical organs in our body, including the brain, the heart, the lung, kidneys, and all of our muscles. This weakening of the heart will induce significant neurohormonal changes in our body. These neurohormones, which is circulate in our system, will lead to some complication on the long run. For example, some of these hormones will make the heart work harder because of increasing resistance. In a simple way, I tell most of the patients, like when you have a very high blood pressure, for example, the heart has to work against it like lifting a weight. So that will keep resistance against lifting that weight and make the heart weaker on the long run. The second complication possibly from these hormones which is secreted because of the congestive heart failure include tightening or spasm in the arteries, and that will limit the oxygen supply to the heart, leading to what we call ischemia or circulation problem in the heart. Additional to that, these hormones which is activated because of this congestive heart failure will lead to abnormality in our electrolyte balance, including sodium and potassium, which is allowed to the fluid to leak in the lung. And that will build up the fluid in the lung, causing the symptoms of what we call congestive heart failure, including the trouble breathing, difficulty to taking a deep breath, difficulty lying down flat. All of that's just the symptoms of compromising the heart muscle function. We call it congestive heart failure. Let's talk about the heart failure symptoms. As we explained it, the weakening of the heart will have difficulty delivering enough oxygen and blood to our system. That will lead to many symptoms. Shortness of breath, or what we call it dyspnea. Fast heartbeat, or what we call it tachycardia. Difficulty lying down flat, and that what we call it orthopnea. The heart enlarge and weaken further and cannot take more blood coming back to it. And that will lead to more complicated symptoms. In the second stage, we notice that the patient has distended neck vein, where the veins are very enlarged in their neck. They start building up fluid in their lower extremities and legs, what we call it edema. The liver and spleen will start getting congested, and that's why they will start having ascites, what we call it, which is building up fluid in their bellies. And they will start having buildup of fluid in their lung, what we call it pulmonary edema. If we talk about the reasoning of the congestive heart failure, we need to look into the basic of the problem. The most common reason for the weakness of the heart muscle is blockages in the arteries, as we explained before. What we call it ischemic heart disease. In that case, because of the difficulty delivering blood and oxygen to the heart muscle start getting weaker over the time, leading to significant symptoms, as we explained. Some of the other less common reasons is valve disease. When the valves start failing, the patient have enlargement in their heart, building up fluid in their lung, building up fluid in their legs, and that's what we call again congestive heart failure because of the valvular problem. Some of the rare etiology, infection in the heart muscle itself, we call it myocarditis. Some of the other causes is drinking alcohol heavily. That will lead to alcoholic cardiomyopathy. On top of that, there is some other rare disease. We don't have the time to explain all of it, but these are the four most common problems we concentrated on. That will lead us to the treatment. So the treatment for congestive heart failure has more than one aspect. The most important one is the patient compliance and taking care of himself. Dieting is so important for the patient, specifically when we are talking about salt intake. Additional to that, taking the medication is so important, and compliance with the physician recommendation. On top of that, we have to treat the underlying cause. If it was an infection, we have to treat it. If it was alcoholism, we have to stop drinking. If it was blockages, we have to treat it with angioplasty or bypass surgery. But sometimes we fail, despite all of that, to regain back the heart muscle function the way it should be. And the patient ends up requiring some further aggressive intervention, which is one of those modalities we are going to talk about in the second segment when we come back. Now, if you have any symptoms to suggest that you have congestive heart failure, you need to pay attention to it. Don't ignore it, please. If you have a trouble breathing, if you have swelling in your legs, if you're having some kind of difficulty lying down, if you're having significant chest discomfort, the most important thing, which I always try to emphasize on, to talk to your family doctor. He is the captain who can order some testing, identify your problem, because we want you to get the appropriate treatment. It's so simple to start the treatment with some medication, dieting, exercising, because we don't want you to be that sicker person who is going to end up requiring the further treatment, which is including mechanical devices and surgeries, trying to help him. Don't be one of those people who needs extreme intervention. Coming up next, we will talk with a patient whose heart is being helped by an LVAD. You will learn about his heart condition before the operation and how he is doing now. Plus, learn all about the procedure from our local expert, Dr. Benal.
Are you constantly worried about your loved one's health while they live alone? Are you considering moving them to a nursing home or assisted living facility because you think there is no other option? Well, now there is an alternative.
Blood pressure received. Blood pressure is 180/70.
Let Advantage Home Telehealth's trained nurses provide around-the-clock remote monitoring of your loved one's health, while they enjoy the comfort, convenience, and security of being in their own home.
Received. Blood glucose is 137.
With our Bluetooth-enabled technology, Advantage Home Telehealth gives you the freedom and mobility to do the things you want to do, anytime, anywhere.
Pulse ox received. Pulse 80 beats per minute. Oxygenation 98.
And now I'm happy baking cookies with my granddaughter.
Now I can spend my Sundays watching football with the guys.
Making our dream of seeing Niagara Falls a reality.
Today we are here to introduce a new procedure done in Northwest Ohio. As we promised earlier, that we are going to talk about the most advanced technology we are doing in Northwest Ohio to educate the patient, to educate the people about what we can do and what we can do. And we are fortunate that in the last few months, basically, that Toledo was chosen one of the areas to introduce what we call LVAD, which is left ventricular assist device. We are going to talk to some of the experts who are doing this procedure at this point in our community. At the same time, we were fortunate to have a meeting with Jim, who is one of the patients who had that procedure. And we're going to talk to him for a few minutes about how he went through the process to be chosen as one of the patients, and then how he is recovering from his procedure, which he had a few days ago. Hi, Jim.
Hi.
How are you?
I'm doing quite
well.
well.
You look great,
thanks.
by the way, after this
good.
procedure.
Feel real good.
Excellent. Tell me what happened and how did you end up to be a patient who ended up to require this device?
Okay, well, for the last 16 years, I've had congestive heart failure, cardiomyopathy, and I was doing quite well on 15 to 20% ejection fraction, and then in September I had a blood clot hit my lung, and I came in here and my ejection fraction was down to 5%, and they tried several different procedures that did not work, and pretty much the LVAD was my only choice.
But your lifestyle wasn't that great, I understand, for a few years.
No, it's been, it's been tapered for the last 16 years.
Were you able to play golf, for example?
No.
Are you expecting yourself to do that?
I certainly will be.
Great.
Yeah.
Now, you were chosen as one of the candidates, and you had the surgery, which is we're going to talk to Dr. Schwan in a few minutes. So, how is your recovery in the last few days until you get to this point?
It's been very, very good. I'm feeling a lot stronger, and I don't think things could have gone better.
Great. Do you have any grandchildren? Do you have?
I do. I have 3 grandchildren.
Do you expect to run after them and play with them?
Oh, absolutely.
Good. Good for you. Good for you.
Yeah.
Good. So, we have here Dr. Banal, who is the assistant professor cardiothoracic surgery in University of Toledo, and as we discussed earlier, we are going to talk to him as an expert in the device we talked about earlier, which is the LVAD, left ventricular assist device. Hi, Mark.
How are you?
I'm fine. How are you doing?
Thanks for having me.
Welcome to the community.
Well, thank you very much.
Dr. Banal joined the community here a few months back as one of the experts in transplant and circulatory system assist device, and we are happy to have him here because really we were looking for this kind of progress in our community. So Mark, tell us about the new technology, the LVAD, and what is it, and when we use it, and who are the candidates for it?
As you've already alluded to, a left ventricular assist device is nothing more really than a blood pump, a very specially engineered blood pump that's compatible with our bloodstream and the platelets and things that make blood clot, that will take over most of the pumping function for the left ventricle. In other words, the part of the heart that pumps blood to the body. We still rely on the right side of the heart. The patients that we'd be looking at for this device are patients that have end-stage heart failure. In other words, they've reached really the limit of heart failure, have symptoms where they're short of breath almost all the time, particularly taking a shower, trying to get dressed in the morning, things like that, or who have been admitted to the hospital several times within a calendar year for symptoms of heart failure. And this indeed is a pump that was out of a patient that also received a transplant, but this is the pumping part of the pump right here. This is the part of the pump that goes up inside the left ventricle, and it sits right up under someone's rib cage like this. The pump itself is fully implanted. It's in a pocket that is underneath the stomach muscle, but not inside the abdomen. It's kind of like a sandwich. And then this, what we call the drive line, is nothing more than a power cord, and it will then exit the body just below the rib cage over on the right side, and then it plugs in like you're plugging in a piece of stereo equipment to some batteries in the control unit that I think you've already explored with our patient over here.
The most important point that this is a bridging procedure. This is just a transitional procedure for a period of time until the patient will receive the transplant heart, right?
Well, that has been the most popular use of this device, although it is designed both as a bridging device, and not only to transplantation, but also potentially to myocardial recovery. In other words, recovery of function of your own heart.
So how is the recovery process? Is it a long period, short period, or like any open heart surgery for a few weeks and then hopefully the patient will be doing very well?
The usual aches and pains after any sort of operation like this are present, but I think most folks by a month or 6 weeks out are doing quite well and functional, able to take care of themselves. The follow-up is a little bit intensive up front. We see patients typically on a weekly or bi-weekly basis for a couple of months as their physiology, in other words, how their the other side of their heart's working and their lungs and their kidneys and all that are adjusting to having blood flow again. They haven't had normal blood flow sometimes for years, and there becomes a time there where we have to tweak medicines a little bit, or turn the pump up a little bit, or turn the pump down a little bit, depending on how the rest of their body is doing. Basically sort of getting them in a good relationship with the pump itself. And then after several months, that becomes, you know, quite a stable situation, and we don't have to do very much anymore.
If the patient having a major cardiac problem where his heart is failing, he should talk to his doctors, he should talk to his cardiologist, and now you are aware that we have it in this community. And probably your cardiologist will be able to communicate with the university here, where we are fortunate to have this procedure done. We were looking for it for a long time, and now we have it. So probably it will be a great idea to talk to your cardiologist and mention it to him. Even if we don't mention it to them, maybe you should remind us about that so we can connect you with the right channel and try to discuss all of these options with the university about what is the best treatment for you. Mark, thank you very much. You were very helpful, and we appreciate it, and hopefully we'll see you again.
It was an honor, and thank you so much for featuring this and spreading the good word.
That's our job.
Thank you.
Thank you. Coming up next, we will talk again with our patient Jim about his life now after the LVAD. Plus, Dr. Schwan explained why Toledo has been selected for this LVAD procedure. Coming up next, we will talk again with our patient Jim about his life now after the LVAD. Plus, Dr. Schwan explained why Toledo has been selected for this LVAD procedure.
How does science advance the art of healing hearts? Through breakthrough discovery and treatment, the work of the foremost heart specialists at the region's only university medical center, the University of Toledo Medical Center, a higher degree of healing. How does discovery accelerate a stroke victim's recovery? Through breakthrough science and treatment, the work of the foremost neurologists at the region's only university medical center, the University of Toledo Medical Center, a higher degree of healing.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is My Outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
For years, it has been common knowledge that people who are under a lot of stress have an increased risk of heart disease. But what can be done about it? Have fun, dance, golf, sing, garden, experience love. Your heart will thank you. Smile at life, it will smile back at you.
To learn more, go to WTOL.com, Health Track.
Because time waits for no one. Just going back to the point Jim just mentioned earlier about the congestive heart failure, it's really the definition of weakness of the heart muscle for multiple reasons. It could be ischemic or blockages in the arteries, it could be valves problem, it could be infection, as we're going to see many patients having these issues in the next few episodes. And we're going to talk about it with Jim right now about the device itself, which was inserted surgically by the surgeon during a major open heart surgery. And he has a controller for that machine. Probably you remember the Vice President Cheney, who had this device done a few months back, and that was a transitional period for him to end up on the transplant list, and successfully he had the transplant a few weeks ago. And Jim, tell me, what do you have here?
This is the controller. Basically, it's the computer that runs the pump, and I have to wear this 24/7. And during the daytime, I'm on batteries, and at night I switch over to a controller that's plugged in electrically.
Are you scared that the battery will be dead?
Well, they gave me 8 batteries, and there's a signal. This controller, it's got tons of bells and whistles. If the battery gets low, or the batteries get low, it will give you a signal to change them.
That's the point I was trying to make, basically. These are very safe technology. At this point, everything, it's alarming, and it's ahead of time. It's not like few minutes, and he doesn't have the time to do the changes which is necessary for this. It just happened a few hours probably before it's needed. Also, we are going to talk to Amy, who took care of Jim after he had his surgery. And Amy, just tell me, how was it the recovery for Jim?
Oh, well, taking care of Jim afterwards was a little intimidating, but it's pretty exciting, though, to see these patients get a new lease on life with this new device.
Did you feel proud that you have it here in the center, and we are really part of the process and the work?
Absolutely. I think this is really great for Toledo.
I think Jim is going to nominate himself to be the vice president next.
Okay. I'll vote for you.
There you go.
Good. From the medical standpoint, taking care of this device and the process after the procedure, was it more complicated, or it was like standard, taking care of everything post-open heart surgery?
Oh, no, it's not standard. It's very complicated, and there's a lot to learn, and we're all excited to have this here at the university, and we're all learning a lot about it, and he's teaching us, and we're teaching him, and it's been awesome.
Excellent. Again, I want to mention that the University Center is one of the few centers in the country who are eligible, and they are doing this device. It's not a simple procedure. It's a complicated procedure, and it has to be trained staff and trained physician to do this procedure, and we are very proud to have it in our community. Welcome back. It's my pleasure to introduce to you today Dr. Thomas Schwann, who is the chairman of the Cardiothoracic Surgery in University of Toledo. And he is one of the experts we're going to discuss over the next few weeks with about some of the open heart surgery, minimally invasive procedure. But today we are concentrating with him about two things. The first one is the LVAD, which we discussed earlier with another expert. And at the same time, we're going to talk about minimally invasive surgery. Tom, thank you for being here.
It's a pleasure. Thank you.
So we discussed the LVAD, left ventricular assist device. Just tell me, what was the reason you decided to support and bring this program to our community?
Well, this is a resurrection of a program that was here for a long period of time. It was a lot more complex. The devices were a lot more difficult to implant. The patients were having a lot more, their success rates were substantially lower. The discomfort was substantially higher. And somewhere in the early 2000s, that program, principally because due to the death of one of the principal supporters of that program, because of his death, the program went by the wayside. And we felt that at this point, given the fact that the explosion of congestive heart failure persists, we believe that it would be a community-based asset to bring it back to Northwest Ohio and resurrect it. And over the years that we have not been participating with the LVAD program and mechanical circulatory support, there's been dramatic differences and dramatic improvements such that the operation is much easier, the outcomes are much better, the durability is much longer, and the patients can really benefit. We do know that given the fact that our patient population is aging and the fact that the transplant numbers will not increase due to the shortage of donors, the only solution is a mechanical solution. And consequently, as the technology continues to improve and evolve, we believe that this is something that Northwest Ohio and the university, as well as all the physicians within our community, could bring to our patients.
Specifically, we introduced to the patient that if they have that heart failure, to talk to their doctor, maybe they are a candidate for this. This is really what your goal.
So our imperative is exactly as you had enunciated so very nicely. From our perspective, this is a community-based resource. We have no other services that are available to our patients within the community. We are currently partnering for potential transplantation with the University of Michigan as well as Ohio State, so that the patient can be evaluated, can be treated, can have their mechanical circulatory device implanted here in their own community without having to travel. And then when an organ becomes available and they are a transplant candidate, then that relationship will have been cemented, and then the patient leaves the community for the transplant and then would come back here for further care. And the hope is that, once again, this is a community-wide and community-based endeavor and a community-based asset with support from various medical centers and various clinicians.
Great. And I think we are very glad to have this program in our community, no question about it.
Are you constantly worried about your loved one's health while they live alone? Are you considering moving them to a nursing home or assisted living facility because you think there is no other option? Well, now there is an alternative.
Blood pressure received. Blood pressure is 180/70.
Let Advantage Home Telehealth's trained nurses provide around-the-clock remote monitoring of your loved one's health while they enjoy the comfort, convenience, and security of being in their own home.
Received. Blood glucose is 137.
With our Bluetooth-enabled technology, Advantage Home Telehealth gives you the freedom and mobility to do the things you want to do, anytime, anywhere.
Pulse ox received. Pulse 80 beats per minute. Oxygenation 98.
And now I'm happy baking cookies with my granddaughter.
Now I can spend my Sundays watching football with the guys.
Making our dream of seeing Niagara Falls a reality.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
For years, it has been common knowledge that people who are under a lot of stress have an increased risk of heart disease. But what can be done about it? Have fun, dance, golf, sing, garden, experience love. Your heart will thank you. Smile at life, it will smile back at you.
To learn more, go to WTOL.com, Health Track.
Because time waits for no one.
A warm hunting cabin, a tent pitched on the lake, the Maumee River packed with fishermen. I'm Matt Markey, and this is my outdoors. We'll look under the water in Lake Erie and in our many rivers and streams. We'll turn over a few rocks in the fossil park in Sylvania. We'll watch eagles nesting, hawks hunting, and ducks and geese filling the sky. There's no limit to what we can see and experience in the outdoors, and we'll investigate it all. I'm Matt Markey, Tuesday, Friday, and Sunday in the Blade.
In summary, if you start having any symptoms to suggest congestive heart failure, please try to talk to your doctors, because it's so easy to detect the problem and get the appropriate treatment at the right time. So for that reason, don't be one of those patients who is going to require more aggressive measures, including surgical interventions like using the LVAD to save their lives. Because remember, I always say, time waits for no one.